A very good morning, a very warm welcome to one and all who have actually made it here today. Good afternoon, good evening, whichever part of the world you are watching this live from or listening to the recording later. The first ever VUCA collaboration conference on healthcare. I want to specifically thank our organizers, the various associate partners, PHDCCI, the CEO of PHDCCI, Dr. Ranjit Mehta, and 9 Publishing CEO, Mr. Manish Rastogi, who is also coordinating the Healthcare Continuum Thought Leadership Forums. Special thanks to our associate partners, including several companies, and I want to specifically welcome Dr. Sudhir Srivastava, who is the founder CEO of SS International Robotics, which is India's indigenously developed, made in India cardiac surgery robot. Huge and a very proud moment for all of us as Indians that such state-of-art medtech technology is actually being manufactured and developed here in Delhi. So welcome, sir. Very warm welcome to our social impact associate partner, Sri Madhusudan Sai Institute of Medical Science and Research. We have Mr. Tanmay Hegde, who is the Chief Operating Officer. We have Dr. C.S. Hiremath, who is the Chief Cardiac Surgeon, Director, Heart Valve Bank and Academics, and who has been inspiring people to donate a heart. You'll hear more about it on the Heart Valve initiative. Setting the stage for VUCA, understanding how preempting, mitigating, and managing the potential VUCA challenges in healthcare is going to help. Let us analyze the word VUCA. VUCA stands for volatility, uncertainty, complexity, ambiguity. No brainer. But it's a concept, a paradigm. I can tell you as a professor of practice and off-campus professor at many institutes of eminence. I've been teaching VUCA for the last 20 years myself, but the concept has existed almost for the last 40 years. In 1987, born during the US war with Vietnam, where Vietnam had resorted to guerrilla style of warfare. US was actually losing the war, and then they came up with this framework of how to navigate and how to conduct warfare in a volatile, uncertain, complex, ambiguous environment such as forest in Vietnam. Eventually, of course, I think Vietnam went on to win the war, but the true victory was the arrival of this concept in the management world, which is so relevant. In fact, I remember when this conference topic and this conference was a brainchild of Mr. Manish Rastogi, and we were talking about this casually 2 months back when I met him by chance. I asked him, why did you not talk about BANI, brittle, anxious, nonlinear, incomprehensible? And that is the future. That is what COVID has left us with, because COVID has put us through this tumultuous experience of forced and accelerated digital transformation. And we have seen industries being wiped out in seconds. We have seen newer technologies like, the Zoom call, which I'm using today to record my talk, telecommuting to the next level, and collaboration, cross-collaboration across the world happening at scale. Why did we not talk about BANI? The fact is, while BANI highlights a lot of this brittle, anxious, nonlinear, incomprehensible concept, the state of fragility and the emotional strain that we are experiencing, especially during and post VUCA, the fundamental relevance of VUCA still remains. The healthcare sector is constantly under flux. We have a lot of transformation, complex regulatory landscapes, global interconnectedness, global supply chain, distributed supply chain, and the ethical dilemmas which technologies such as generative artificial intelligence, quantum learning powered artificial intelligence, especially with the use of AI in diagnostics and genomics. Some of the pressures which we are facing to make this accessible, affordable use of healthcare using the latest and greatest of technologies, when we operate among, such global situation, I would say institutes which are in the social sector, therefore, like Sri Madhusudan Sai Institute of Medical Science and Research, which incidentally was launched by our Honorable Prime Minister as the world's first free rural medical college. You'll hear more about it by Mr. Tanmay and Dr. C.S. Hiremath. But they are revolutionizing the quality care being provided free of cost across multiple hospitals. They have hospitals in Nigeria, Fiji, in India, and also multiple primary healthcare centers in the form of telemedicine. A lot of organizations doing this, but what is unique about SMS IMSR is not a single penny, not a single paisa is charged by anybody, and it is addressing quality, accessible, affordable care to the last individual who is literally at, I would say, a rural setting area. So VUCA is not just about industries thriving, industries growing, industries learning from their mistakes, but how nonprofits such as these can innovatively disrupt status quo and set new standards, not just for social impact, but providing quality, affordable healthcare in an equitable manner. So today, along with our esteemed partners, our co-organizers, several advisory members, so many people who burnt the midnight oil to make this happen. Thank you for everybody who has come here once again. This conference is not just an exchange of knowledge. It is not just a thought leadership session. It is about fostering a new journey, sharing the best practices, and I'm sure it is going to lead to a collective resilience strategy where we implement VUCA strategies across the spectrum of policy, astrology, and analytics, business sustainability, VUCA leadership mantras, mapping, mitigating, managing disruptive innovations, de-risking supply chain, corporate jugalbandi at boardroom, and ESG and climatized supply chain. I would like to sign off here from Mexico City. I was invited here by United Nations to represent India and present focus of efforts which we have been putting in the space of anti-corruption and anti-bribery. A country which is as vast and diverse and as advanced technology as India is also in a constant state of VUCA. And to bring in the stability to the country in such a VUCA environment, the efforts of the United Nations Global Compact have truly been formidable and worthy of great appreciation. And that's the reason I could not be. Once again, I apologize to one and all. I would have loved to be here with all of you, but I'm sure that there'll be further opportunities where this dialogue is going to translate not just as thought leadership sessions, but walk the talk, rubber meet road kind of action plans and action items. I'm sure you're going to see a melting pot of fabulous technologies, business models, thought leader sessions. Godspeed, good luck to everybody. And I look forward to receiving the conference proceedings from Mr. Manish Rastogi post this event. And I'm sure this is the first step of a long odyssey of tackling VUCA challenges in healthcare. Thank you once again. Have a great session.